is set up to find out, well, in fact, we may need to treat this population because they're at potential risk for getting other sexually transmitted infections. And so to come in to get screened, they come to the clinic to do a simple self-collected vaginal swab. And within 2 to 5 minutes, we can determine whether they have bacterial vaginosis or not. So it's very simple. So that's why we want to encourage all women. So, and the barrier for us is that women tend to say, well, I know I don't have BV. Because in their head, they're thinking, I need to have itchy, smelling, something going on down there. But that's not what we want. We want normal, healthy young women to come in to be screened because, in fact, they potentially are at risk for BV and they don't know they have it. And so that's why I really want to emphasize that, is that BV usually may not have any symptoms, and that's the population that we really want to focus on. And the screening is very simple. You're not laying on an exam table to get a pap smear. And some women don't want to go through the trouble. It's a simple, long Q-tip swab that you collect yourself in the restroom. You don't even have to take your full bottom off, to collect that specimen. It's kind of like putting in a menstrual tampon, which is actually, it's more, that's more invasive than than the actual swab. It takes 5 minutes. And we pay you just for us to be able to look at your vagina micronisms. We want that specimen from you, so we're paying you to do that, And so we pay women, as of now, $10 just to do the screening. And I say that because we are trying to revise that as of now. But now you get $10 just to get the screening. Once you qualify for the study, you get an additional $25 in cash. And then if you qualify, just like I said, we fill out another baseline form. You collect some baseline specimens, and then you're enrolled in the study. So the total screening process takes less than 20 minutes if you are qualified for the particular study. So it's worth everyone's while to come down, get a little cash. $10 is not very much, but I mean, it's gas money. You go to the movies or so forth. But then also when you're enrolled, you're helping out a national research study, and you're getting a little extra money on the side as well. And you're being proactive in your sexual health. And that's another thing I want to put out there is young women, especially young African American women, need to be more proactive in their sexual health.
And when you say come on down, do they have to make an appointment? Do you make it online, or do you call, or do you just show up?
Actually, the best time, we actually do screenings from Monday through Friday, typically from 8 to 4 o'clock. However, Purnima and I are the only research staff. So it's best to call our personal cell phone numbers. We have, I think you have them there, and we'll mention them. So also you can email us at bravostudy2008@yahoo.com, and that's spelled BRAVO study2008@yahoo.com. They can email me, ask me more personal questions if they like, and more detailed information about the study. And they can call my personal cell phone. When participants are actually enrolled in the study, they will primarily deal with me. So it's not like they have to call an office and they're transferred from phone to phone. They will personally contact me, and we can build a relationship with each other as well. I like to really make my participants feel comfortable. A lot of my participants who are enrolled in the study now, they don't just call me for the study. Some of them need other resources. Some of them have children. Some of them are in educational institutions and they want to further their careers. I'm in school myself, so I have a lot of other connections with the community as well.
So well, you're being so good with your answers today. So when they enroll, see, now that I've busted you up, then I forgot my question. Why is it so important? Like, what happens during the study? Sort of, do they have to take a pill, or are they just like, what do they actually have to do besides doing the self-screening? Like, are they taking pills every day, or are they just...
They will. So it all depends. So once they enroll in the study, participants are randomized into a treatment group, into a non-treatment group. So if the participants are in the non-treatment group, they won't get treated with anything. Just like I stated before, standard U.S. protocol is if you have no symptoms, you're not treated with metronidazole. The standard protocols, if you do have symptoms, you are treated with the antibiotic called metronidazole. which is not a study drug, and I want to emphasize that this is the standard medication they use in the event that a woman would come in for a BV. Metronidazole is used for a lot of various things as well, bacterial infections.
The study is primarily to see if we can change the indication for treatment. So it's not an experimental drug. If a woman came in and said, I do have discharge, and we find out that she has BV, she would be treated with exactly the same medication.
As if you went to the doctor anyway.
Exactly, and you would get tested
So
for
the only difference now is we want to try and understand, by treating bacterial vaginosis, is it possible for us to reduce the chances that a woman would pick up an STD? So that's one of the reasons why we want to actually start treating women with asymptomatic BV.
And in order to do that, we must compare the two groups, the non-treatment group and we call it a control group, and then a treatment group.
Really quickly, can you say that email address one more time so we can put it up on the screen for people who are watching?
No problem. Bravo, BRAVO, study 2008 at yahoo.com.
Oh, good.
And my personal cell phone number I would like to include is 415-525-7718.
Oh, good. Maybe we'll be able to put it up. Okay. We're working in here on that. No maybe that will be up on the screen at some point. So how does this all sort of in a more general sense affect women's health if they are at greater risk for certain STDs and they may not even know it?
Well, like we said, at least most of the women who are experiencing these STDs, or STDs in the United States, it's called the hidden epidemic, because most of the women who are having it are asymptomatic. And also there's this huge stigma associated with going to the doctor and getting diagnosed with an STD. So, but
I know it always seems like it's better not to know, but in reality, it's probably better to know. Like, you don't want to know, but it's better if you do know.
That's one of the reasons why BV is not considered a sexually transmitted disease. Like I said, 1 in 10 women are going to be affected by BV if you're sexually active. So it's nice to be screened, and by finding out whether one has BV or not, one thing is you're clearing up your own stress and fear about whether you have any kind of a condition down there. And even if we do find some other infections when we're screening the women, we are treating them. So it's a nice way to come, get treated for STDs without having to wait for 1 hour to see your clinician. And this is what is going to happen right through the period for 12 months when we follow. Every 2 months, we're going to be screening the women for STDs. And if they do have an infection, we are treating them.
And are they just acting normally, like in their sex life, and they're just going about their business?
Going about their business. We don't want to change anything about their sexual health. We want them to be potentially 18 to 25 years old, higher risk, or 18 to 20. We want them to be sexually active. African American or Hispanic especially, but not to exclude any other race, because we still want all women, but we emphasize African American and Hispanic because they have the highest rates of STDs. In the United States, and it's extremely high, and I just want to stress that because it's continually to grow. And a lot of times chlamydia can be asymptomatic as well, and because it causes infertility and so forth, and it just causes a lot of damage in the long run. So we want women to get early detection, early treatment.
Oh, good. And what are some of the other requirements if people are interested in coming to the study?
So some of the other requirements, I'll go over some of the risk factors, is that we do a pre-qualification, and we have a list of risk factors. So you currently cannot be pregnant. You cannot live with your husband or partner for over 1 year. Temporary housing. We just have to have an address where we can send the kits to you, because we'll be mailing them to you. So we don't want to be mailing them into a place where you're not going to be steady.
Someone else will get it.
And emphasize that this study is completely confidential. So no one's name, your name won't be listed on any documentations, only for us to mail you the kits. And just like I said, currently you have to have sex within the last 3 months to participate in the study. African American, Hispanic, 18 to 25 years old, women who've had a previous STD in the past definitely will qualify. Women who douche at least once a month definitely will qualify for the study as well.
Interesting.
Or who have had more than 2 partners in the past 1 year.